Why is cerebellar stroke rehabilitation so intensive? Imagine trying to learn how to walk again after a sudden stroke affects your brain. Cerebellar stroke rehabilitation is often very demanding because the cerebellum is like the brain's control tower for movement, balance, and coordination. When this area is damaged, the effects can be complex and wide-ranging. The cerebellum helps us fine-tune our movements, process sensory information, and learn new motor skills. Damage here can cause severe issues like ataxia, which is a lack of coordination affecting the whole body, difficulty standing or walking, problems with speech and swallowing, vision disturbances, and even emotional changes. These challenges impact everyday activities and safety, making intensive therapy essential. One big reason rehabilitation is so intensive is because of the complex motor and sensory problems that arise. For example, ataxia can make walking or using your hands unsteady and unpredictable. Patients often struggle with basic movements like standing, balancing, or reaching for objects. Restoring these skills requires therapy that targets multiple systems at once, such as strengthening muscles, improving coordination, and retraining balance. This process takes time and effort. Another reason is that effective recovery depends on neuroplasticity, which is the brain's ability to reorganize itself. When the cerebellum is damaged, other parts of the brain can sometimes take over some functions, but this requires repetitive, targeted exercises. Patients often need months or even years of consistent practice to see meaningful improvements. Because cerebellar strokes can directly affect motor learning, therapy must be intensive to promote new neural connections and help the brain adapt. Rehabilitation also involves a team of specialists. Physical therapists work on strength, coordination, and balance. Occupational therapists help regain fine motor skills and daily activities like dressing or cooking. Speech therapists address speech and swallowing problems. Sometimes vision therapy is needed for visual disturbances. Coordinating all these disciplines demands a lot of time and expertise. The severity and variability of symptoms add to the need for intensive therapy. Some patients may have severe impairments that requiring careful, gradual progress. Initial prognosis can be uncertain, especially if complications like swelling or bleeding occur. Patients often start with inpatient care and then move to outpatient therapy, gradually building skills and confidence. The goal is to improve safety, independence, and quality of life, which requires careful assessment and personalized plans. Emotional and cognitive challenges are common too. Emotional lability or difficulty communicating can make therapy more complex. Psychological support and communication strategies are often part of the process. In practice, many patients undergo therapy sessions of at least 3 hours a day, 5 days a week, involving different specialists working together. This demanding schedule is necessary because the brain needs repeated, focused practice to recover lost functions. While progress can be slow, the effort is crucial for maximizing recovery and helping patients regain independence. In summary, cerebellar stroke rehabilitation is intensive because the cerebellum influences so many aspects of movement and sensation. Damage here causes multifaceted impairments that require comprehensive, multidisciplinary, and repetitive therapy. The goal is to restore safety, mobility, and independence, making the effort well worth it. Always remember, each person's recovery journey is unique, and consulting healthcare professionals is essential for tailored treatment.